The first thing we have to see, the most commonly asked use of adrenaline, number A, will be anaphylactic shock. Anaphylaxis or anaphylactic shock. So this is the use. We'll draw a table according to the type of questions which are asked. Second thing which is asked, what is the route of administration of adrenaline in this particular use? Third thing that they ask, what is the concentration of adrenaline for that particular use, and what is the dose of adrenaline in that particular use? So first thing, use number 1, anaphylaxis. One more question I'll add for our understanding, why is adrenaline used in that particular situation? So in anaphylaxis, you see the main mediator is histamine. Histamine is responsible, or the main mediator of anaphylaxis. Histamine causes bronchoconstriction and vasodilation that results in fall in BP. So patient of anaphylaxis is dying of two problems. His lungs are constricted, he is unable to breathe, and his BP is rapidly falling, caused by histamine. What is the physiological antidote, physiological antagonist of histamine? Adrenaline. We will give this patient adrenaline. Why? Adrenaline, by acting on beta 2, will cause bronchodilation, and by acting on alpha 1, it can cause vasoconstriction. So in lung it will cause bronchodilation, it can also cause vasoconstriction. So it's called a physiological antagonist of histamine. That is the reason. Can NA produce bronchodilation? Answer is no. NA does not act on beta 2, so it cannot produce bronchodilation. That is why NA is not the drug of choice for anaphylaxis. Clear? Adrenaline is the drug of choice. Now comes the route of administration. This is an medical emergency situation. So anaphylaxis, patient may die in few minutes. So what route should be preferred? Again, we think IV is the fastest, that is the best route possible, but that is not the case. The best route that we try is intramuscular in this case. So the preferred route is IM. Why not IV? That is the question. So you will remember that IV adrenaline has a high incidence, high risk of causing the cerebral or the CNS bleeding, and high incidences of causing arrhythmia. So when we give adrenaline intravenously, there are significant risk. The patient may develop cerebral hemorrhage, patient may develop arrhythmia. So we do not prefer that route in anaphylaxis. What is the route we prefer? IM. Second thing is asked, what is the concentration of adrenaline? So concentration is 1:1000. Again the question comes, what is the meaning of 1:1000? Suppose I'll give you a clinical scenario. You are the emergency medical officer. A patient comes to emergency and you diagnose this is a case of anaphylaxis. You ask the sister that drug of choice is adrenaline 1:1000. Get me the injection. Now the sister, what she does, she comes back to you with a vial with the adrenaline powder and the solvent, that is distilled water, and she gives them to you and says, Dr. Saab, you do what is 1:1000. But you don't know what is 1:1000. You've just mugged it up in theory. So I hope you understand the importance of understanding what is 1:1000. What is 1:1000? What does it mean? So 1:1000 means 1 gram of adrenaline dissolved in 1000 ml of water. 1:1000. 1 gram dissolved in 1000 ml. Now 1 gram is equivalent to 1000 milligram. So it is actually 1000 milligram dissolved in 1000 ml. So 1000 cancel. So this is actually 1 milligram per ml. That is the meaning of 1:1000. 1000. Okay, 1:1000 means 1 gram dissolved in 1000 ml. So that comes out to be 1 milligram per ml. So now this is also clear concentration. Now they ask what is the dose. The dose is you will give 0.5 ml of 1:1000. So you will take 0.5 ml or half ml or 0.5 ml of 1:1000 solution and inject IM, that is the life saving. So 0.5 ml here means how much milligram of adrenaline. So we can say that 1:1000 is 1 milligram per ml. So 0.5 ml will have 0.5 milligram of adrenaline. So that is all about the use of adrenaline in the first use, anaphylaxis. Why it is drug of choice? What is the route? Why not IV? What is 1:1000 and what is the dose? So I hope this is clear, the first use.